Imagine a world where your health and future are dictated not by your choice, but by your bank account. This is the harsh reality for many people today. Socioeconomic status significantly impacts reproductive health choices, influencing access to healthcare, family planning options, and overall health outcomes. Growing up, I saw friends and people in my community face significant barriers to accessing reproductive healthcare. These personal experiences drive my passion to bring awareness to this issue.
First, let's talk about the limited access to healthcare services for lower income individuals. Studies show that individuals in lower socioeconomic brackets are less likely to have health insurance. According to the National Center for Health Statistics, nearly 15% of lower income adults do not have health insurance, compared to 4% of higher income adults. Many people in my community have delayed or forwent reproductive health care because they couldn't afford insurance. Consider the anxiety and helplessness of a young woman who cannot afford a simple checkup, let alone necessary treatments. In rural areas, clinics offering reproductive health services are scarce, forcing people to travel long distances. The Guttmacher Institute reports that 87% of U.S. counties do not have an abortion provider. I've heard from friends and their families that they have had to travel over 50 miles to reach a clinic, missing work and risking their jobs just to get basic care. Think about the exhaustion and financial strain this places on families already struggling to make ends meet. High medical costs deter many from seeking necessary reproductive health services. The cost of a simple pap smear can be costly, often exceeding $100 without insurance. I've seen friends choose between buying groceries and getting a necessary health checkup. Imagine having to make such a heartbreaking choice. While access to healthcare is a substantial barrier, the ability to afford family planning options presents another challenge. Economic constraints restrict family planning options. Contraceptives, while necessary, are frequently too expensive for those with limited income. A month's supply of birth control pills can cost up to or more than $100 without insurance. A friend of mine had to stop using her preferred contraceptive method because it was too costly. Consider the fear and uncertainty of not being able to control your reproductive health. Government programs that provide free or subsidized family planning services are frequently underfunded. Funding for Title X family planning programs has been cut significantly in recent years. Many people I know rely on these programs to access services. Imagine the frustration of knowing help exists, but it's out of reach due to lack of funds. Lack of education and resources leads to higher rates of unintended pregnancies among lower income families. The CDC reports that low-income women are 5 times more likely to have an unintended pregnancy than higher-income women. I've seen the cycle of poverty create a lack of access to family planning education and resources. Think about the stress and long-term impact on families who cannot plan their futures. Beyond family planning, socioeconomic status also influences overall reproductive health outcomes. Inadequate prenatal care increases the likelihood of pregnancy complications for lower income mothers. The March of Dimes states that low income women are more likely to experience complications during pregnancy. Some women I know have suffered preventable complications due to lack of prenatal care. Imagine the heartache of a mother who loses her baby because she couldn't afford adequate care. Financial instability can cause high stress levels, which can lead to poor reproductive health. Research shows a clear link between high stress and adverse reproductive health outcomes. In my experience, the constant stress of financial insecurity takes a heavy toll on people's health. Consider the ongoing impact of daily financial stress on one's overall well-being. Access to postpartum treatment is frequently restricted for those with fewer financial resources, compromising long-term health. Many insurance plans do not cover comprehensive postpartum care, leaving new mothers vulnerable. I've observed new mothers struggle to recover without proper medical support. Think about the long-term health implications for both the mother and child when postpartum care is neglected. Given these harsh realities, it's evident that socioeconomic status plays a crucial role in reproductive health. In summary, socioeconomic status has a significant impact on access to healthcare, family planning options, and overall reproductive health outcomes, emphasizing the need for systematic change. Let us push for policies that promote equal access to reproductive health care, regardless of income or social status.